What I was asked to talk about today is what are the addiction issues facing Oklahoma? And so I'm going to build a little bit. Sorry, you hand me my water. I've got some here, never mind. I'm going to build a little bit on what Dr. Kolodny said as I talk about opioids, but I'm going to talk about the 4 addiction issues facing Oklahoma, of which opioids is one of them. And you know that kind of outrage you were feeling at different points during Dr. Kolodny's presentation about how did we let this happen? How did we let so many opioids into our society? How did all of this occur? You're getting ready to feel that on some other things, because this is a huge issue facing our state. In fact, it's the biggest public health problem facing our state. So today, as we're talking about the SANS, 300,000 Oklahomans over the age of 12, so 12 and up, so adults, 85, kids who are 15, 300,000 Oklahomans over the age of 12 meet the requirements for needing substance abuse treatment. They're already addicted. 300,000 of our family, our friends, our neighbors, our fellow Oklahomans. Rates of addiction and overdose related to opioids do remain at a crisis level. We do have some good things, and so you're going to see some good news in my presentation, as Dr. Kolodny mentioned. But thank God we're coming down, because we are still near the top. We have a long way to go, but we are making some improvements. We know that the primary drivers for all the things that we want to see different in Oklahoma require having treatment for mental illness and addiction. We will impact our foster care rates. We will impact our divorce rates. We will impact the number of people ending up in the criminal justice system. We will impact the number of people dying, because we're dying at an alarming rate from preventable causes of death if we got people treatment. So when we combine mental illness and addiction, there is no doubt when I make the statement addiction is the most pressing public health issue. That's true. So let's talk about how we get into this situation. And it is about our perceptions of risk. Attitudes about substance abuse. When we believe things are risky, we don't use things. When we believe they're not risky, we do. And you just saw this with Dr. Kolodny's presentation. When doctors thought opioids were dangerous, they prescribed them rarely. When they were convinced and they were told these are not dangerous or addictive, what happened? The prescribing rates went up. When we perceive a substance to be dangerous and we see risk, we don't use it. When we think it's not dangerous, use rates go up. 63% of Oklahoma adolescents, our kids between the age of 12 and 17, perceive no great risk from having 5 or more drinks twice a week. 5 or more drinks at one setting. Not 5 or more drinks over the week. I mean once or twice a week having 5 drinks in one setting. 63% of our adolescents don't perceive that as a great risk. We know that the past month's substance use among Oklahoma 12th graders is decreasing. Actually for everything, because we're convincing them of the risk, except one thing. What have we been telling Oklahoma kids across, not just Oklahoma kids, but across the nation? Marijuana is medicine. And so what's happening? Marijuana rates and use of marijuana among youth is going up. Why is that so dangerous? For those of you that heard me speak before, you will have heard this, so explain it to your neighbor if once I explain this doesn't make sense. The prefrontal cortex of the brain, that front part of the brain where all of our executive functions are housed, our judgment, our critical thinking, our logic. That is the last part of the brain to finish the majority of its development. Now, our brain does grow and change our entire life, but we know that the majority of brain development happens from birth to about age 20 to 25, with the prefrontal cortex being the very last part to finish developing. It finishes developing, actually, between the age of 20 and 25. It's why when people sometimes say they're frustrated with teenagers' decision-making skills, I am not excusing teenagers' behavior, but what I am saying is that truly their prefrontal cortex isn't fully developed. As soon as they reach that development between 20 and 25, they're going to have a little bit better skills because it's going to be finished. And here's the kicker and the killer on addiction. If you use substances, whether it's alcohol, whether it's marijuana, whether it's opioids, whether it's meth, if you use substances before your prefrontal cortex is fully developed, you are more likely to become addicted and locked on than if you wait till after your prefrontal cortex is developed. There are actually chemical changes that take place in the brain that are like protective factors. So when we talk about alcohol, for example, if you use alcohol at the age of 15 for the first time, compared to someone who uses alcohol at the age of 21 for the first time, you are 5 times more likely to become dependent on alcohol if you used it at 15 than if you waited until the age of 21. So when I'm talking about today, as I'm going to talk about addiction, that I was asked to focus on these 4 substances and what's facing Oklahoma, I want you to keep in the back of your mind, or probably at the forefront, because I'm going to say it a lot, we have to figure out how to prevent kids from using substances. Because if we can do that, we will automatically decrease the rate of addiction. We won't eliminate it. Because as an adult, as we know with the opioid crisis, we have a back injury, we have a car accident, we have dental work, we get prescribed an opioid at whatever age, 35, 55, 65, and we can become addicted. We will become addicted, actually, when you're talking about opioids, because they're so highly addictive if we start using them after just a few days. But what we know is that the highest risk problem we have is young brains using substances because they don't perceive a risk and they're more likely to become addicted. So what's the average age of first use of alcohol in Oklahoma? It's 13. Average age of the first time youth, and I'm not talking about a sip. When I'm talking about use, the way this is studied in the data is it's actually talking about using this substance more than a taste or more than a sip. It's actually drinking. It's 13. As I mentioned, it's actually 6 times when you look at age 15 versus 21 more likely to become dependent and struggle with these issues later in life. When you look at our system, those who seek treatment in our system, and remember, we're the Department of Mental Health and Substance Abuse Services that fund a network of providers, so many of our partners I see here today. To get into treatment through our system, you have to be very, very ill, and you have to either not have resources or have lost everything by the time you get to us. Because we only serve, as the state, we only serve those who are the most ill, because right now, we're resourced to serve 1 out of every 3 people who need help. So we have to decide every day who we're going to help and who we're not going to help, which is a really lovely thing to have to do in the world of healthcare. Because basically what we have to do in Oklahoma, because if we're so underfunded, although we are making progress, there are some good things happening, but because we're so underfunded, we have to say every day, we're going to have to serve those most in need, those who are at the greatest risk of overdose, those who are at the greatest risk of losing their job or their family or becoming incarcerated, because we have to ration our services. And if we don't serve those most in need, we know really bad things are going to happen. So those who are in the beginning stages of an illness, we'll see you when you get worse, right? But we can't move our resources to the beginning stages because then we really will see an increase in death. So what that means is that when you look at our system, 85% of those who seek treatment for alcohol began drinking before their 18th birthday. That's not surprising. If we can prevent kids from using, we can decrease our rates of all addiction. So why does this matter as I talk about kids dying? Well, guess who else dies? Oklahoma adults at a higher rate than the rest of the nation. First of all, if you're not aware, I've got some news for you. We're not a healthy state, right? So when you look at our average lifespan, which is the far right bar, and up here it kind of looks like a funky green-brown. So it's that far right bar. The average lifespan in Oklahoma for men is about 76 years old. That's already dying too young. Men in other states live longer than men in Oklahoma because we're not healthy. But guess what happens if you live in Oklahoma and you have an untreated mental illness? Your average lifespan is the far left bar. It's only about 57 and a half years old. If you have an untreated addiction, it's 43.2 years old. And if you have both mental illness and addiction together, and that often happens because it's the same organ in the brain, if you have untreated mental illness and addiction, your average lifespan is only about 40 and a half years old. We lose over 30 years of life with our family, our friends, our neighbors, members of our community of faith, people we went to school with, people we work with. our fellow Oklahomans because we're not treating their brain health. We're not providing at the rate we need to, because when you provide treatment, these stats completely change. And because we're not preventing substance use among our youth. So let's see why people are actually dying. So there are a host of other physical health issues that develop when you have an unhealthy brain, but I'm actually going to focus on the 3 causes of the deaths of despair. And this is new research that's been really talked about in the last couple of years. So this may be some information you haven't seen, and if you've seen it, your job is to take it and show other people, because we clearly have a lot of people who need to understand this. I am grateful for the legislators I see here in the room. You have to take this back to your colleagues, but more importantly, we have to take this back to their colleagues, because this is what's killing Oklahomans. In 2016, the Commonwealth Fund works in conjunction with Harvard University, found that Oklahoma was one of only 7 states in the nation where the death rate from 3 causes of death, drug overdose, suicide, and liver disease related to alcohol use and cirrhosis, had now surpassed 200 deaths for every 100,000 Oklahomans. The death rate for Caucasian Oklahomans between the age of 25 and 65 doubled from 1999 to 2009, right? As I'm doing the math right, over a 10-year period, the death rate for Caucasian Oklahomans doubled from these 3 reasons. We keep thinking that we're going to live longer than our parents, right? Every generation has lived longer than their parents, until we start not addressing brain disease, until we start seeing the kind of increases that we're seeing. It's not surprising that in April of 2018, the Journal of American Medicine ranked Oklahoma 49th for the shortest and least healthy life, with an average life expectancy now of going to 64 and a half years. We have got serious issues facing our state, and what they're finding is that the study traced the prevalence of 333 different health problems to figure out what was going on, and 84 risk factors over a 26-year period from 1990 to 2016. And what they found is the 3 biggest things affecting our death rate, the deaths of despair, was drug overdose, suicide, and alcohol-related consequences. So let's talk about some of these deaths of despair. We just spent a little bit of time on poisoning deaths, so you've seen some of the Oklahoma stats, but I think it's important just to be reminded of these. You can see in yellow opioid overdose deaths, and you can see we are trending down. So this is something we should be excited about, but we also need to realize we have got a long way to go, a long way to go. 153,000 Oklahomans 12 years and older misused prescription pain relievers in the last year. The percentage of pain reliever misuse was twice as high among our young adults between the ages of 18 and 25, at the time when their brains are the most vulnerable. We are doing something wrong in terms of how we are messaging to our kids, in terms of how we are talking to our kids, or if we're even talking to our kids about these issues. The most common prescription drugs involved in Oklahoma overdose deaths, not surprisingly, are oxycodone, hydrocodone, and fentanyl, and luckily we don't have fentanyl here at the rates that some other states do. But we are still seeing our fellow citizens die at unbelievable rates, because in 2015 there were 833 non-fatal inpatient hospitalizations among Oklahomans, but we lost almost the same number in overdose deaths. So this is a map. You saw Dr. Kolodny's maps of the United States. Now we're going to look at some maps of Oklahoma just for a second, so you can see what we're facing in terms of unintentional poisoning death rates. The darker the county, the worse the outcomes in the case of this map. That doesn't mean that we have counties that don't have overdose death rates, but what it means is that you can see where we've got to concentrate our efforts. And this map has actually changed over the last about 6 years. The highest counties, and we continue to have struggles, but the highest county used to be Tulsa County. And so we went in with the first appropriation we got from the state of Oklahoma. Thank you to those legislators who are here, and to Governor Fallon, who fought for this the second year of her first term, and said we've got to appropriate money for the prevention of opioid misuse and drug overdose. And we went in and concentrated our efforts in Tulsa. And the reason that we chose Tulsa is because Tulsa County had the highest overdose death rate in Oklahoma. And it was the 18th highest county in the entire United States for overdose deaths. And so what did we do? We concentrated on that medication-assisted treatment, the Suboxone. We also equipped every single law enforcement officer in Tulsa County with naloxone, and every first responder, fire, ambulances already had it, but fire, ambulance, police, and sheriffs, because when you call 911, one of those entities is going to be the first on the scene. And if you're in an opioid overdose, naloxone, a life-saving nasal spray that you've probably seen several articles about thanks to the Oklahoman trying to get this message out there, will save your life and force you to breathe until you can get to an emergency room. So there are a lot of things we're doing right, but we still have a long way to go. Okay, so now we're going to talk about alcohol. And the first thing I want to say, and I actually hadn't planned to quite talk about it in quite this way, but when I heard Dr. Kolodny speak, it was one of those moments where I thought, okay, I'm going to help us understand this in a way that sometimes we don't, because we have a different view of alcohol than we do things like illegal drugs or now opioids. So let's talk about opioids for just a second. What Dr. Kolodny was just saying is that in 1995, we started prescribing more opioids. And so what happened? Use went up, addiction went up, and deaths went up. We are getting ready in Oklahoma in a few days. I don't actually wear a watch, but in a few days, we are getting ready in Oklahoma to ensure that 4,000 more outlets can sell high-content alcohol than can today. What happens when we have more locations selling high-content alcohol? Well, we don't have to guess. We're going to watch it happen in Oklahoma, but several other states have gone before us. And you know what happens when you have more locations selling high-content alcohol? You sell more high-content alcohol. And guess what the University of Oklahoma has found for the last 3 years they've studied this for us? Kids with a real ID, not a fake ID, can buy alcohol 33% of the time they walk into a retail establishment. So as we're talking about this issue, we're going to have to start thinking about how are we going to protect kids to decrease our addiction rates from opioids, which means we're going to lock them up if they're in our medicine cabinet. We're not going to give our kids opioids. We're all there. We've got to be focusing on alcohol as well. Excessive drinking results in 1,350 deaths and 41,460 years of potential life lost due to excessive alcohol use every single year in Oklahoma. More Oklahomans died from excessive alcohol use last year than from opioid overdoses. Excessive drinking costs Oklahoma, this is another study done by the University of Oklahoma, $2.4 billion in 2010 as a result of crime, healthcare, and lost workplace productivity directly related to alcohol use and alcohol addiction. Overall, in the United States, 54% of alcohol deaths and 76% of the costs are related to excessive drinking, not low or moderate drinking. Okay? Excessive drinking is 5 or more drinks in one sitting. Remember when we were talking about 5 or more drinks just a minute ago? And that 64% of our kids don't perceive a risk of having 5 or more drinks in one setting. Kids drink differently than adults. I'm not suggesting we don't have adults that binge drink, because we do. But we know kids drink differently than adults because 90% of the time that they drink, they binge drink. They're drinking 5 or more drinks in one setting. So sometimes when I talk about binge drinking, people aren't sure what this means. Well, let's look at some of these statistics. What you can see up there is what binge drinking and heavy drinking looks like. And the amount of alcohol. There is no amount of alcohol that is safe to use during pregnancy, and I will tell you that that perception has been changing in the last decade. The number of women who believe it is okay to have a glass of wine during pregnancy has changed. It is much higher today than it was 10 years ago and than it was 20 years ago. There is no amount of alcohol that is safe for a brain to drink if their prefrontal cortex isn't developed. There is no amount of alcohol that is safe for someone under the age of 21 to be drinking. For women, heavy drinking is 8 or more drinks in a week. And I love when I start having these conversations because alcohol is the one where for some reason people start to get a little more uncomfortable. And it's because of the fact that about 3/4 of us drink alcohol. I'm not saying regularly, but we actually use. So I know this may be making you uncomfortable, but this is critical that you hear this, because the other piece that is so important is that we have to understand any time we model behavior, our kids see it. And I'm not suggesting that we shouldn't drink, but what I am suggesting is that if you're not having conversations with your kids about how alcohol affects your brain, and I can tell you right now, the most of us haven't. I'm actually different. If my 8-year-old was here, he can give my speech. This is my own little experiment. We're going to see if prevention really works. But I actually know from the research that it does. And because I have these conversations with my child, he's much less likely, because he has a high risk perception of alcohol. He's much less likely to ever use. So all I want you to feel today is that we got to start thinking about how we're having to have this conversation with our kids. Binge drinking. As I mentioned, it's binge drinking that causes the majority of problems. It accounts for 90% of the alcohol use in youth, and more than 40% of binge drinking costs are paid by the state government. I need money for prevention and treatment, so if we could decrease our rates of binge drinking so it's not all tied up in dealing with those consequences, without raising taxes, we could fund the treatment system and a bunch of other things. Binge drinking obviously is related to car crashes, sexual assaults, violence, firearm injury, unintended pregnancies, STDs, fetal alcohol spectrum disorder, and neurological damage. In Oklahoma, 13%, 12.8% of adults report that they do binge drink. It's 1 out of every 10 of us. 1 out of every 10 of us binge drinks. In our high school students, it's 1 out of every 5. Adults outpace the U.S. in binge drinking intensity at an average of 8.4 drinks per binge occasion in Oklahoma. That's huge, huge. So now we're going to talk about marijuana. So for marijuana, because we are sending a whole lot of messages to our kids right now about marijuana, whether we realize it or not. Marijuana is the most commonly used illicit drug in the United States and in Oklahoma already. 200,000 Oklahomans aged 12 and over used marijuana last year. 35,000 Oklahomans used marijuana for the first time last year. Every year, about 35,000 Oklahomans use it for the first time. And the most frightening statistic of that number is that of those 35,000, 19,000 were between the age of 12 and 17. 19,000 were between the age of 12 and 17. What you're seeing here, the blue bars, is marijuana use over the last 5 years as reported to the Department of Mental Health and Substance Abuse. Meth is the dark orange. We're coming to that in just a second. The 4 drugs we're talking about today is going to be prescription drugs, alcohol, marijuana, and meth, because if you looking at the orange, you'll see in just a minute, meth is, we have issues already, it's rising. Opioids are actually the light orange. The problem is, as we know, opioids are the most deadly in terms of overdose. But we have a whole lot of people using marijuana and a whole lot of kids using marijuana, and the fact is, when you start with marijuana, you're more likely to become addicted to other substances as well, because once your brain starts that chemistry, you're more likely to become addicted to other substances. So before we go to meth, I actually don't know if I can make it go. Okay, so let's talk about marijuana for just a second. Most states, or at least many states, who have some form of medical marijuana prohibit its use with children. In Oklahoma, we have no age limit. In Oklahoma, under the current state question that passed, unless our legislature comes in and adds regulations that look like what other states look like, 12-year-olds can be given a recommendation for marijuana. 8-year-olds can be given a recommendation for marijuana. 19-year-olds can be given a recommendation for marijuana. The health department in their regulations went in and tried to say that there was going to be an age limit. You had to at least be a certain age. That age, if you look at the science, should be when your prefrontal cortex is developed. It should be 25, if we really want to address this issue and protect our kids. CBD is a different issue. CBD does not have the intoxicating ingredients. If you get CBD that doesn't have THC, THC is the substance that I'm worried about. THC is what we should prohibit our children from putting into their bodies. And we certainly shouldn't allow, because I can tell you most of the physicians in Oklahoma are not going to be prescribing marijuana, probably to anybody. Certainly not to kids, but there are plenty of people that we're finding that will. There are people who are coming to our state. There are a few people in our state, unfortunately, who have already been published, which is a mistake, to list the name of doctors in publications who will give you marijuana. It is not helpful to help this problem along unless we're going to ensure that our kids cannot get access to it. Now, I have a whole nother speech on adults, but if you'll just focus with me on the kids today, that would be a really good first step. Methamphetamine. In fiscal year 16 and 17, methamphetamine, unfortunately, has become the primary drug of choice by those who seek our services for substance abuse treatment. It is rising. It is rising. We have had this before, as we know, but it is coming right back up. And so as we talk about these substances, we cannot have a real conversation about addiction in Oklahoma without talking about methamphetamine, which is stimulants. In 2016, 278 Oklahomans died from methamphetamine overdose. The fact is, methamphetamine addiction is absolutely treatable. This is one of my favorite slides. Several of you have probably seen me use it before, but what you're looking at here, and I am actually not a physician, although we have a physician on our panel, as you know, with Dr. Kolodny, but I'm not going to get real medical. I'm going to talk to you in layperson's terms, but what you're looking at here in the brain on the left are the dopamine transporters part of the brain. It's the dark blue outline with a lot of that hot pink. That's what a healthy, normal dopamine transporters look like in the brain. The brain in the middle is someone who's been struggling with methamphetamine abuse. They're actually 1 month clean and sober in this picture, and you can see that the dopamine transporters aren't functioning in a healthy, normal way. But the amazing thing is the brain on the right. 24 months into recovery, the dopamine transporters are returning to normal functioning. Treatment absolutely works. It works better if you didn't start as a kid. Your prognosis is better, but it absolutely works, but only if we let you in the door of the treatment center. If we put you in the back of our amazing partners' police cars, or jail cells, or prison cells, your brain is not going to get a lot better if you're struggling with mental illness or addiction. But if we would widen the door, so right now we have, on any given day, 700 to 900,000 Oklahomans standing on one side of the door who needs treatment, and our door is so narrow that we are only able to let in 197,000 of them to treatment. So if we could widen the treatment door, and if we could invest in evidence-based prevention and keep our kids from using in the first place, we could completely change what Oklahoma looks like in terms of brain health. We have great outcomes happening in our state. We just let too few Oklahomans experience those great outcomes. And as a result, we see premature death, incarceration, unemployment, all of those things that we don't want to see, because we don't put enough into prevention or treatment. But the negative consequences don't end there. We see family fragmentation, children in foster care, poverty, problems in the classroom. We know that all of this comes back to brain health. But we have some great things happening. We are one of the leaders in medication-assisted treatment, the bunorepinephrine, the Suboxone. We have gone from having only 7 providers to having almost 20 in the last couple of years. We've gone from having a few doctors wavered, because get this, here's another funny piece in my mind, although really not, and we need to implore our federal government to remove this from the statute. As a physician, you don't have to have any special certification to prescribe opioids. As a physician, to prescribe Suboxone and bunorepinephrine, you have to have a waiver from the DEA, and you're limited to how many people you're allowed to treat with that life-saving medication. So we have worked in conjunction, and it's not just us, so many partners in this room, but with the medical licensure boards and the medical associations to really try to bump up the number of physicians we have who are waivered in our state. We're now up to 200 physicians who are waivered and who can prescribe. Doesn't mean they all are. We're trying to convince them all to do it, but they're waivered. We also have made amazing progress with law enforcement on the front lines who are carrying naloxone, who are saving lives. For those of you that don't actually know, the reason people die from an opioid overdose, again in layperson's terms, is when you take opioids, it slows your respiration. The reason you die of an opioid or a heroin or a fentanyl overdose is it slows your respiration to the point you stop breathing. What naloxone does is it's a nasal spray. It blocks your opioid receptors and forces you to breathe for about 30 to 45 more minutes. And hopefully, if you're in urban Oklahoma, you can get to an ER in that time. But if you're in rural Oklahoma, I can give you another dose while I'm still trying to get to our ER, which is far away. And we can do this until we can get you there and save your life. We also have some amazing suicide prevention programs. I didn't spend as much time on this today, partly because I have a limited time, but that is one of the 3 deaths of despair in Oklahoma. Suicide is highly correlated with the untreated mental illness, but it is really highly correlated with untreated mental illness mixed with substance abuse. Most people who die from suicide, not all, but most people who die from suicide also have substance in their body at the time. We also have amazing criminal justice diversion programs. Our law enforcement, our judiciary are doing some great things in our state, so I want you to know that there's hope. I want you to go to okimready.org. This is the perfect forum for the new launch of okimready.org. Our developers are in the room. For those of you that used to see, when we used to talk about prescription drug abuse, I used to direct you to a website called takeasprescribed.org. Because when we started this effort 7 years ago, that's what we thought we were supposed to say, right? Dr. Claudine's like, yep, take as prescribed. And then we realized, holy cow, don't take them. Don't take them. That's not the answer. So this is our new launch. Take as prescribed has now migrated to okimready.org. I'm okay, I'm ready to listen. Okay, I'm ready to stop. When you go to this website, you will see all these different things. Okay, I'm ready to help. It's all the things you can do to prevent opioid misuse. It shows you everywhere you can go in this state to get treatment, where the waivered doctors are, where the medication-assisted treatment is available. It has amazing stories, amazing stories. It is how you can start having this conversation with your kids if you're not sure how to have it. okimready.org is where you need to go. And lastly, this is my last slide. I see them bringing lunch out. You just have to eat quietly. I'm almost done. When we don't do this, we go broke as a state. When we don't invest in prevention and treatment. Treatment are the blue bars. On average, for everything Oklahomans need, if we had invested in our system $2,000 per Oklahoman in need, not per Oklahoman, just per Oklahoman in need, we could have the entire spectrum of services we needed across the state. I'm showing you, I've pulled out of that first blue bar the cost for drug court, which is about $5,000 a year, or mental health court, which is about $5,400 a year, but it's actually all part of the average. When we fail to provide treatment in the blue, the first red line is just one hospital stay from someone who shows up in an emergency room and is admitted to the hospital. It costs about $15,000 for one hospital stay. 1 year incarcerated in the Department of Corrections, that second red bar, costs us as taxpayers about $19,000 a year. One child in the foster care system costs us about $21,000 a year. I could have treated 10 or 11 moms or dads for that amount of money. And I used to only have 6 bars. And then one of my sister agencies, the Department of Corrections, and their director, who continues to cry out and ask that we invest in mental health and substance abuse treatment because he has far too many people that are in his prison system that don't belong there. He said to me, you've got to add this 7th bar. Because when we incarcerate someone in the state of Oklahoma who has severe mental illness, SMI, it actually costs us as taxpayers about $23,000 a year. So we're leaving our money right now tied up in the red. And if we could find a way to invest in the blue, we could then decrease the red spend and have money to do everything else we wanted to do in this state and see all of the outcomes we want to see for our kids and for ourselves. Thank you very much.